I am Dr. Vandana Soni with another interesting and learning episode of B.Pharma on the important unit of general consideration and application of drug delivery system part 2. Let's start our episode while taking a look what we are going to learn today. We learn about the ocular drug delivery system and prodrug delivery system. This is the part of previous chapter as a module 4 and module 5. With module 4, we learn about the ocular drug delivery. In module 5, we learn about the prodrug followed by conclusion. Module 4, ocular drug delivery system. Our discussion is devoted to the ocular drug delivery system. Drug delivery system to the eye is one of the most challenging tasks to pharmaceutical scientists because eye is a complex organ with unique anatomy and physiology. The structure of the eye can be divided into two main parts, anterior segments and posterior segment. Anterior segment of the eye occupied approximately 1/3 and the remaining portion is occupied by the posterior segment. The tissues such as cornea, conjunctiva, aqueous humor, iris, ciliary body and lenses make up the anterior portion. Back of the eye are, that is posterior segment of the eye, include sclera, choroid, retinal pigments, epithelium, neural retina, optical nerve and vitreous humor. The structure of eye is shown on your screen. The anterior and posterior segment of eye is affected by various vision threatening disease like glaucoma, allergies, conjunctivitis, anterior uveitis, cataract, age-related muscular degeneration and diabetes retinopathy are the most prevalent disease. Tear turnover, nasolacrimal drainage, reflex blinking and ocular static and dynamic barriers pose a challenge and impede deeper ocular permeation rate are some of the anatomical and physiological constraints for drug delivery to eye. Hence, less than 5% of topical applied dose reaches to the deeper ocular tissue. Also, it is difficult to achieve therapeutic drug concentration into posterior segment ocular tissue following topical eye drop installation because of the above mentioned barrier. In some cases, intravitreal injection, periocular injection and systemic administration are some of the available methods for drug delivery to the posterior segment of ocular tissue. To overcome the ocular drug delivery barrier and improve ocular bioavailability, various conventional and novel drug delivery systems have been developed such as emulsion, ointments, suspensions, aqueous gel, nanomicelles, nanoparticles, liposomes, dendrimers, implants, contact lens, nanosuspension, microneedles and in situ thermosensitive gels for the earlier mentioned ocular disease. Now come to the advantages of ocular drug delivery system. First one, increase the ocular viability of the drug by increase the corneal contact time. This can be achieved by effective adherence to corneal surface. Second one, increase accurate dosing. Third one, overcome the side effects of pulsed dosing produced by conventional system. It also provides sustained and controlled drug delivery, provide targeting within the ocular globe, so prevent side effect to ocular tissues, circumvent the protective barriers like drainage, lacrimation and conjunctival absorption. It provides comfort, better compliance to patient and to improve therapeutic performance of drug. It also provides better housing of delivery system. There are some factors that affects the ocular drug delivery systems. First one is nasolacrimal damage across the nasal mucosa affects the drug absorption. Conjunctival drainage is another responsible factor for drug loss. Third one is dilution of drug by tear secretion causes decrease in absorption of drug. Next is metabolism in precorneal area. Next factor may be drug entity, pH, tonicity of dosage form. They are also affect the drug absorption, ocular drug absorption. There are certain barriers are present for the ocular drug delivery. Drug loss from the ocular surface. After installation, the flow of lacrimal fluid removes instilled component or drug from the surface of the eye. Drug absorption into the systemic circulation also decreases the drug concentration in lacrimal fluid extensively. Second barrier is lacrimal fluid eye barrier. Corneal epithelium limits drug absorption from the lacrimal fluid into the eye. The most apical corneal epithelial cells from tight junctions that limit the paracellular drug permeation. Third barrier is blood ocular barrier. The eye is protected from the xenobiotics in the blood stream by blood ocular barrier. This barrier have two parts, blood aqueous barrier and blood retina barrier. The anterior blood eye barrier prevents the access of plasma albumin into the aqueous humor and also limit the access of hydrophilic drug from plasma into the aqueous humor. Now, most important part is mechanism of drug absorption. This can be explained by corneal absorption, by outer epithelial, which is also known as rate limiting barrier, having pore size 60 angstrom only, access to small ionic and lipophilic molecule. Second mechanism is by transcellular transport system. This transport system occurs between the corneal epithelium and stroma. Then third one is non-corneal absorption. In this, penetration occurs across the sclera and conjunctiva into the intraocular tissue. It is non-productive because penetrated drug is absorbed by general circulation. Then cornea mechanism of drug release. The mechanism of controlled drug release into the eye is as follows. First one is by diffusion, by either by osmosis or by bioerosion. In case of diffusion, in the diffusion mechanism, the drug is released continuously at the control rate through the membrane into the tear fluid. The release of drug can take place by diffusion through the pores. While in osmosis mechanism, the insert comprises a transverse impermeable elastic membrane dividing the interior of the insert into two compartments. The first compartment is bounded by the semi-permeable and impermeable elastic membrane, and the second compartment is bounded by an impermeable material. There is a drug release aperture in the impermeable ball of the insert of second compartment. The first compartment contains a solute which cannot pass through the semi-permeable membrane, and the second compartment provides a reservoir for the drug which is in liquid or gel form. When the insert is placed in the aqueous environment of the eye, water diffuses into the first compartment and stretches the elastic membrane to expand the first compartment and contract the second compartment, so the drug is forced through the drug release aperture. While in bioerosion mechanism, the configuration of the body of the insert is constituted from the matrix of bioerodible material in which the drug is dispersed. Contact of the insert with tear fluid result in a controlled sustained release of the drug by bioerosion of the matrix. Bioerosion may be due to chemical or enzymatic hydrolysis reaction that lead to polymer solubilization or degradation to smaller water soluble molecules. So, this is about the ocular drug delivery system. Now come to the conclusion part. Advent of nanotechnology, new techniques, devices and their application in drug delivery was delivered a huge interest to scientists. These new techniques and devices are used to overcome the problem that are associated with the particular drug or delivery systems. For example, the viability of mucoadhesive drug delivery system enhances by utilizing the physicochemical characteristics of both the dosage form and the mucous lining. Similarly, pulmonary drug delivery with the novel devices also possesses many advantages, including non-invasive route of administration, low metabolic activity, controlled environment for systemic absorption, and avoid first pass metabolism. Novel ocular drug delivery offers beneficial effects to the patient by minimizing the drug induced toxicities and protect from vision impairment, etc. The prodrug approach is also used to overcome the various obstacles to drug formulation and targeting. With all these information, here we comes to end of today's lecture, application of following drug delivery system part 1. Do keep in mind what we discussed today. Time for you to self-study. I will be back with more lecture in this series application of following drug delivery system part 2 that deals with ocular drug delivery system and prodrug delivery system. If you want to learn more and enhance your knowledge, you may log on to our website www.cec.nic.in for MCQs, quizzes, LORs. Till then, keep studying. Goodbye. Based on their design, that is a structural association and site of conversion into the active drug. The first one is prodrug based on a structural association of molecule. Prodrug are categorized into 4 classes. They are given as follows. First one is carrier link prodrug, bipartite prodrug, tripartite prodrug, mutual prodrug, polymeric prodrug, bi-precursor prodrug, the double prodrug concept. Now come to the carrier link product. Non-toxic carrier group or moiety is attached to the drug to form a new compound. For example, dipavinyl ester of epinephrine. Second one is bipartite prodrug. The structure of most products are bipartite in nature, in which parent drug is attached directly to moiety. In tripartite prodrug, that is prodrug utilized a spacer or connector, the group between the drug and moiety. And in case of mutual product are defined as a two pharmacological active agent joined together so that each act as a moiety for other and vice versa. Second is polymeric product. It is also known as macromolecular product. In this, drug is dispersed or incorporated into polymer system without formation of covalent bond between the drug and polymer. Example, paraphenylene diamine mustard is a covalently attached to polyamine polymer backbone polyglutamic acid. Third one is bioprecursor type of product. In case of bioprecursors, they are the inert molecule obtained by the chemical modification of active drug but do not contain carrier. Such molecules have almost the same lipophilicity as the parent drug and bioactivated generally by redox biotransformation. For example, phenylbutazone gets metabolized to oxyphenylbutazone that is responsible for the anti-inflammatory activity of the parent drug. Now second classification, that is classification on the basis of the site of conversion into a active drug from prodrug. It can be classified into two types based on their site of conversion. Type 1, which are converted intracellularly. For example, antiviral nucleoside analog, lipid lowering statins, antibody directed enzyme prodrug. This is also known as ADEPT. Type 2, which are converted extracellularly in digestive fluid or in the systemic circulation. Both type can be further categorized into subtype A and B based on additional criteria. Type 1A that is stand for intracellular or extracellular conversion at the site of therapeutic action. Type 1b it is stand for intracellular and extracellular conversion at the site other than therapeutic action. Type 2a and type 2b are categorized depending on whether the conversion occur in the gastrointestinal fluid or systemic circulation. Now come to the most important part, that is related to application of product. First we discuss about the pharmaceutical applications. Pharmaceutical application includes improvement of taste and odor, minimizing pain at the site of injection, enhancement of drug solubility and dissolution rate, enhancement of chemical stability, change in physical form of drug and reduction of GIT irritation. Second part is pharmacokinetic application. Pharmacokinetic application includes enhancement of bioavailability, prevention of pre-systemic metabolism. Now come to the conclusion part. Advent of nanotechnology, new techniques, devices and their application in drug delivery was delivered a huge interest to scientists. These new techniques and devices are used to overcome the problem that are associated with the particular drug or delivery systems. For example, the bioavailability of mucoadhesive drug delivery system enhances by utilizing the physicochemical characteristics of both the dosage form and the mucous lining. Similarly, pulmonary drug delivery with the novel devices also possesses many advantages, including non-invasive route of administration, low metabolic activity, controlled environment for systemic absorption and avoid first pass metabolism. Novel ocular drug delivery offers beneficial effects to the patient by minimizing the drug induced toxicities and protect from vision impairment, etc. The product approach is also used to overcome the various obstacles to drug formulation and targeting. With all these information, here we comes to end of today's lecture, application of following drug delivery system part 1. Do keep in mind what we discussed today. Time for you to self-study. I will be back with more lecture in this series application of following drug delivery system part 2 that deals with ocular drug delivery system and pro-drug delivery system. If you want to learn more and enhance your knowledge, you may log on to our website www.cec.nic.in for MCQs, quizzes, LORs. Till then, keep studying. Goodbye.